Hello everyone, I am Ayushman Dash and today I am going to explain on the topic drugs used in gout. Before that, let's understand what is gout. So gout is basically a purine metabolism disorder in which plasma urate concentration is raised either due to overproduction or due to impaired excretion of uric acid. It is generally characterized by intermittent attacks of acute arthritis. This acute arthritis is caused due to deposition of sodium urate crystal in our joints. So if we classify drugs which are used in treatment of gout, it is classified into acute gouty arthritis drugs and chronic gout drugs. So let's talk about acute gouty arthritis drugs. It includes NSAIDs, colchicine and glucocorticoid. Chronic gout or hyperuricemia drugs, it include uricosuric agents and uric acid synthesis inhibitors. Now let's talk about acute gouty arthritis. It is characterized by severe inflammation in small joints due to precipitation of urate crystals in our joint spaces. Our joint become red, swollen, extremely painful. So it is generally treated with strong anti-inflammatory drug. The mechanism of acute gouty arthritis is like precipitate of urate crystals in synovial fluid is formed, engulfed by synovial cells, release mediator and start inflammatory response, then produces the chemotatic factors due to which granulocyte migrate in joint, then phagocytose urate crystals, release glycoprotein and increase the inflammation finally. Now if we look into NSAIDs, non-steroidal anti-inflammatory drugs, it relieves an acute attack. It is better tolerated than colchicine and uses drugs like indomethacin, naproxen, piroxicam, etc. Diclofenac also can be used. But naproxen and piroxicam inhibit chemostatic migration of leukocyte into inflamed joints. If we look into colchicine, so colchicine is an alkaloid. It is not an analgesic and it is not an uricosuric agent as well. The mechanism of action is it prevents the release of chemotatic factor, inhibit migration of neutrophils to affected area. Therefore, there is no release of factor which contribute to inflammation. It is generally given through oral route or IV. It is rapid acting and poorly tolerated. If we look into adverse action, then it includes nausea, diarrhea, abdominal pain, etc. Chronic use may lead to myopathy, alopecia, aplastic anemia and agranulocytis. Now let's talk about glucocorticoids. They are effective, rapid response used when cases are not responding to non-steroidal anti-inflammatory drugs and colchicine. It is if single joint is affected, then intra-articular triamcinolone is effective. Now let's talk about chronic gout or hyperuricemia. It is characterized by pain or stiffness in joint between attacks. Hyperuricemia, tophi, urate stones in kidney may cause progressive disability and permanent deformities. Uricosuric agents. It involves probenecide and sulfenpyrazone. Probenecide. It is highly lipid soluble organic acid. Competitively blocks active transport and of organic acid OATP, which is organic anion transporting polypeptide at all sites. Generally transport is bidirectional. Net effect of probenecide on excretion depends on secretion and reabsorption. Secretion and reabsorption depend on which is more needed by the body. Uric acid is largely reabsorbed by active transporter while less of it is secreted. Only 1/10 of the filtered load is excreted. Probenicid inhibit reabsorption and promote excretion of uric acid and lower its blood level. If we talk about ADRs, which is important, dyspepsia, skin rashes, hypersensitivity, etc. It should not be given within 3 weeks of acute attack of gout. Probenicid is contraindicated in patient with renal failure. Now let's talk about sulfenpyrazone. It has similar action like probenicid. It is not used in present because it has gastric irritation and other side effects. I'm sorry. Generally, it is used as alternative of probenicid. Now let's talk about drug interaction. Probenicid, when given with beta-lactam antibiotic, which is generally penicillin or cephalosporin, it competes with penicillin and cephalosporin and block tubular secretion of beta-lactam antibiotics. Therefore, plasma level of beta-lactam and their duration of action increases. Now let's talk about uric acid synthesis inhibitors. How uric acid is formed. So xanthin is converted into hypoxanthin by xanthin oxidase, which on reacting with xanthin oxidase again forms uric acid. So allopurinol, it is a uric acid synthesis inhibitor. Its mechanism of action is it inhibits synthesis of uric acid by inhibiting enzyme xanthin oxidase. It then further inhibits plasma urate level. Alloxanthin, metabolite of allopurinol, is non-competitive long-acting inhibitor of xanthin oxidase enzyme. Allopurinol is given orally, should not be given within 3 weeks of acute attack of gout because it may precipitate another attack. It is useful for Kala Azar. Now let's talk about adverse drug reaction. It includes skin rashes, itching, nausea, vomiting. And drug interaction. Drug interaction includes allopurinol and 6-mercaptopurine. Allopurinol interferes with metabolism of 6-mercaptopurine by inhibiting xanthin oxidase and increase its effect. Therefore, allopurinol is commonly used in cancer patients receiving chemotherapy to reduce hyperuricemia. Now let's talk about febuxostat. It is also a xanthin oxidase inhibitor and further decrease the formation of uric acid. Administered orally for chronic gout. Adverse effect: diarrhea, headache, hepatotoxicity. Febuxostat can be used in gout patient intolerant to allopurinol. Rasburicase is another drug which comes under uric acid synthesis inhibitor. Urate oxidase produced by recombinant technology. Rasburicase convert uric acid to soluble allantonin. ADRs means adverse drug reaction, hemolysis, gastrointestinal disturbance and hypersensitivity reactions. Now let's come to last drug of this topic, pegloticase. Similar mechanism of action like rasburicase, administered only through intravenous route, given when patient is not responding to other drugs. Adverse reaction are anaphylaxis. Thank you. I hope I was able to deliver myself clearly. Thanks a lot.